A silent threat to aging minds. Are your medications stealing your memory? By the time you finish watching this video, around 20 seniors will have been diagnosed with dementia. That's one every 66 seconds. But here's the truly terrifying part. What if the cause isn't just aging, but your medicine cabinet? You've been told these pills are safe, routine, and even essential. Yet, recent research is sounding the alarm. An astonishing 99% of seniors have no idea that at least one medication they're taking could be shrinking key memory centers in their brain by over 28% in less than a year. Let that devastating fact sink in. The pharmaceutical industry has known about this for decades. Still, they continue to profit billions from selling the same drugs that may be accelerating cognitive decline in millions of seniors. In fact, a 2023 study in neurology and aging research found that one class of drugs increased dementia risk by 49% in seniors within just 2 years of use. This video will reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from the most commonly ignored to the most mind-destroying. 1. Diphenhydramine, Benadryl. Millions trust the pink pill, diphenhydramine, Benadryl, to help them sleep, soothe allergies, or ease cold symptoms. It's cheap, over-the-counter, and you probably have it in your nightstand right now. You might think you're just taking it to sleep better, but inside your brain, Benadryl can disrupt the hippocampus, the region responsible for storing new memories. Benadryl is part of a group of drugs called anticholinergics, which block a crucial neurotransmitter called acetylcholine. Acetylcholine is a chemical that helps your brain form new memories and stay alert. As your brain ages, it becomes even more dependent on every bit of acetylcholine it has. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic drugs had a 54% higher risk of developing dementia. Avoid anything labeled PM, nighttime, or allergy relief, as these are often just Benadryl in disguise. For allergies, safer, non-sedating options like loratadine, Claritin, do not cross the blood-brain barrier and are a better choice for long-term use. Never assume that over-the-counter means safe. 2. Proton pump inhibitors, PPIs. Medications like Prilosec or Nexium are proton pump inhibitors, PPIs, designed to reduce stomach acid, often prescribed for heartburn and acid reflux. Many seniors stay on them for years, but what's rarely discussed is how PPIs interfere with the absorption of vitamin B12, a crucial nutrient for brain protection, memory, and mood stability. In a 2016 study published in JAMA Neurology, researchers found that regular PPI users had a 44% increased risk of developing dementia. By aggressively suppressing stomach acid, PPIs also interfere with the body's ability to absorb magnesium and calcium, which are essential for neural communication. Without them, neurons struggle to fire efficiently, causing confusion and memory lapses that often mimic early signs of Alzheimer's disease. Safer alternatives exist. Ask your doctor if you can slowly taper off your PPI with the help of H2 blockers like famotidine, Pepcid, which are less likely to interfere with cognition. 3. Bladder control medications. Oxybutynin, Ditropan, a medication for urinary incontinence, seems like a practical solution, but it works by blocking acetylcholine, the same brain chemical disrupted by Benadryl. Unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier more easily and directly affects memory regions in the hippocampus, making it particularly dangerous for seniors. A 2019 study in the BMJ found that people over 65 who took strong medications like oxybutynin for more than a year had a 49% higher risk of developing dementia. Patients often describe feeling foggy, forgetting appointments, and struggling to follow conversations, symptoms frequently mistaken for normal aging. Fortunately, newer medications like Mirabegron, work through a different mechanism and have a significantly lower impact on memory. Fourth, statins such as simvastatin, Zocor, and atorvastatin, Lipitor, are among the most widely prescribed drugs for lowering cholesterol. However, cholesterol is not just a heart issue, it's a brain necessity. The brain is nearly 60% fat, and cholesterol is key to maintaining the protective myelin sheath that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you may be starving the brain of what it needs to function. In a 2023 study published in Frontiers in Aging Neuroscience, seniors on statins for more than 3 years had a 26% higher risk of mild cognitive impairment. Some statins, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily and are considered less risky. If you are on a statin and notice brain fog, it might be time to discuss a dose reduction or alternative strategy with your doctor. 5. Benzodiazepines. Benzodiazepines, including lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are often prescribed for anxiety and sleep problems. They work by enhancing GABA, the brain's calming chemical. A 2022 study in the BMJ found that seniors who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. These drugs cause a chemical sedation that slows neural activity, making the brain less flexible and more prone to confusion and memory gaps. Seniors on these drugs often describe feeling in a fog. If you've been on a benzo for more than a few weeks, do not stop suddenly. Instead, work with a doctor to gradually taper the dose. Alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy can help restore calm without memory loss. 6. Amitriptyline, Elavil. Amitriptyline, Elavil, is an older antidepressant still prescribed for pain, insomnia, and migraines. It's one of the most potent anticholinergic medications in circulation, meaning it strongly blocks the action of acetylcholine. In a massive 2015 study in JAMA Internal Medicine, researchers found that adults who took high cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. Even a low dose taken nightly over several years can create a slow, invisible erosion of brain power. The damage often goes unnoticed because it's mistaken for normal aging. If you or a loved one is on amitriptyline, speak with a physician about alternatives like duloxetine or gabapentin for pain, or melatonin for sleep. 7. Paroxetine, Paxil. Paroxetine, Paxil, is a commonly prescribed SSRI for depression and anxiety. But here's the part they don't tell you. It is the only SSRI with significant anticholinergic properties. A 2021 review in Frontiers in Psychiatry found that paroxetine users showed measurable declines in short-term memory and verbal recall within the first year. The American Geriatric Society has placed paroxetine on its Beers criteria list of medications that are potentially inappropriate for older adults. If you're on it, ask your physician about switching to safer alternatives like sertraline or escitalopram, which do not carry the same cognitive risks. 8. Antipsychotics. This one is especially alarming because many seniors don't know they're taking an antipsychotic. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed for severe psychiatric illness, but are frequently prescribed off-label to elderly patients for agitation or behavioral changes associated with dementia itself. The consequences are devastating. A 2022 study in the Lancet Healthy Longevity found that seniors prescribed antipsychotics were 71% more likely to develop worsening cognitive decline within 12 months. These drugs suppress dopamine, a chemical critical for memory and executive function. This is why seniors on antipsychotics often appear dull, emotionally flat, or zombified. Ask your doctor if these medications are truly necessary. Often, behavioral symptoms can be managed with non-drug interventions like creating structured routines or addressing pain. 9. Anticholinergic polypharmacy, the biggest hidden threat. You may be expecting a single drug to top this list, but the most dangerous medication for rapid dementia in seniors is not one pill. It's the silent, creeping effect of taking multiple medications with anticholinergic properties at the same time, a situation known as anticholinergic polypharmacy. Imagine a senior taking diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each one alone may cause only mild memory problems, but together, the cumulative anticholinergic burden skyrockets. In a 2022 analysis, researchers found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the risk. The good news is that drug-induced dementia is often reversible. By identifying and slowly tapering off unnecessary medications, many seniors regain clarity, energy, and memory function within weeks or months. This requires a medication review with your doctor or pharmacist. This isn't just a dangerous situation. It's a preventable one. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice. Always consult with a qualified healthcare provider before making any decisions about your health or medications. What are your thoughts on this information? Do you have any questions about these medications or the studies mentioned?